Welcome back, everyone. We're now at our final session here at the Centennial Hall on the second day of GEEF 2025. And the session today, session starting now, it will be Better Nutrition for All, Holistic Healthy Changes for Yellow Window. Organized with WITH, this session addresses global nutrition challenges and health disparities in yellow window regions. We're delighted to welcome our moderator for the session, Professor Moon-Gyu Kim at the Department of Pediatrics at the Yonsei University College of Medicine. Let's welcome Mr. Kim and the Dr. Kim and the panelist. Professor Kim, the floor is yours.
Thank you. Ladies and gentlemen, distinguished guests and esteemed speakers. Good afternoon and welcome to the Better Nutrition for All session about holistic healthy changes for yellow window. It is truly an honor to serve as your moderator today. I am Moon-Gyu Kim, professor pediatrician here in Severance Hospital. Malnutrition remains one of the most urgent global health challenges, affecting millions and shaping the future of entire communities. While the scale of the problem is vast, there are also incredible individuals who have dedicated their lives to improve nutrition and saving lives to some of the most challenging environment. Today, we are privileged to hear from experts and practitioners who have worked tirelessly on the ground, fighting malnutrition, implementing solutions, and bringing real change to those in need. Their dedication, resilience, and passion inspire us all, and we are all grateful for their efforts. Without further ado, let me introduce our first speaker, Ji-Sung Woo, General Manager with headquarters. Thank you.
It is my great honor to join the distinguished experts at this esteemed forum. I would also like to extend my sincere gratitude to the team at GEEF for this invaluable opportunity. Today, I will be discussing the strategic framework of WITH, specifically focusing on yellow window and how it helps us address global nutrition challenges. Sorry, I think the presentation is not ready yet. Okay, yeah, it's ready. In the next 15 minutes, I will be presenting in 4 key parts. I will introduce WITH first, then we will explore how yellow window has evolved, highlighting key changes and developments from 2016 to 2025. Finally, I will briefly present holistic approaches for yellow window. Before we explore today's main topic, I would like to pose a question. Why should we be concerned about nutrition in the first place? As you might know, enough nutritious food on regular basis can be considered as the essential basic human right. However, have you ever perceived that hunger kills more people each year than AIDS, malaria, and tuberculosis combined? The World Food Program reports that as of 2021, 9 million people are dying of hunger, which means 25,000 people, 14,000 of them children, are dying every day, which equates to 1 child dying every 6 seconds. Also, according to a 2022 UNICEF report, 1 in every 5 deaths of children under age 5 globally is attributed to severe wasting, which reflects acute undernutrition. Nevertheless, investments to scale up high-impact nutrition interventions could avert 6.2 million deaths in children under age 5 and generate enormous economic benefit. For example, World Bank Group reported that for every dollar invested in addressing undernutrition, a return of $23 is expected, estimated to generate 2.4 trillion in economic benefits. More specifically, early nutrition program can increase school completion and raise adult wages. Children who escape stunting are more likely to escape poverty as adults, and reduction in stunting can increase GDP in Asia and Africa. This suggests that improving nutrition is crucial for the development of least developed countries. In response to these pressing nutrition concerns, our organization, with holistic interest through health, is dedicated to addressing global health and nutrition challenges through our specialized expertise in food and nutrition. Its mission is to facilitate holistic recovery and positive health outcomes for vulnerable communities worldwide through an integrated approach rooted in Christian values, emphasizing love and compassionate service. Devotion, community, service, stewardship, and professionalism are the 5 core values of WITH. And currently, our organization operates in 8 countries across Asia and Africa, including Mongolia, Cambodia, Tanzania, and Madagascar. Now, I would like to introduce our strategic approach called the yellow window, which can guide our intervention strategies. The yellow window framework was established in 2000 as a strategic tool to identify regions with the most pressing nutritional needs, aligning with our organization's nutritional expertise and Christian identity. This systematic approach utilized 6 key indicators, such as infant mortality, life expectancy, poverty rate, and literacy rate, to identify priority areas, and 104 countries were selected for the yellow window. The term yellow was purposefully chosen for its symbolic significance, representing the golden color of life-sustaining grains and serving as a warning signal, much like a yellow card in football games, highlighting the urgent need for nutritional intervention in these regions. In 2004, we revised our framework using 21 international indices, expanding beyond health and nutrition to include political, economic, and environmental factors. This led to selecting 78 countries and evaluating the feasibility of our ministry activities in these regions. WITH carried out its 3rd revision of the Yellow Window Framework in 2009. This update emphasized poverty as a key factor aligned with the Millennium Development Goals and introduced the Yellow Window Index, combining both nutrition and poverty indicators. This approach identified 67 priority countries. In 2016, WITH conducted its 4th revision of Yellow Window Framework, and 73 countries were identified as Yellow Window. This revision was distinguished by 3 key innovations from previous revisions, which I will talk about in detail. First, based on UNICEF's conceptual framework, we extensively incorporated 42 indices that reflect the multi-layered causes of malnutrition: immediate, underlying, and basic causes. This comprehensive approach allowed us to conduct a more thorough identification of countries with critical health and nutritional needs. Second, we recognized an emerging nutrition paradox within the Yellow Window countries: the simultaneous presence of undernutrition and overnutrition. In response to this growing polarization in nutritional challenges, we developed another index to assess this double burden of malnutrition. Third, we categorized the yellow window countries into 3 distinct groups based on their health and nutritional characteristics. For each group, we suggested targeted intervention strategies aligned with the recommendations from the 2013 Lancet series on maternal and child nutrition. Let me talk about these 3 groups a little more. The first S1 group consists of 20 countries where severe maternal and child undernutrition requires immediate attention. These countries need nutrition-specific interventions that focus on direct nutritional support. The second S2 group comprises 42 countries requiring an integrated approach to nutrition improvement. These countries need nutrition-sensitive interventions that address broader factors such as food security, water and sanitation, WASH, poverty reduction, healthcare, education, and so forth. The third S3 group consists of 11 countries that need long-term, system-based, and double-action interventions to address the double burden of undernutrition and overnutrition. These countries need sustainable institutional frameworks to tackle their complex nutritional challenges. Okay, then let's move on to examine the nutrition-related changes in yellow window countries over the past decade from 2016 to 2025. As shown in the graph, we can observe an overall decreasing tendency in undernutrition of children under 5 years across yellow window countries. Notably, the rate of improvement for both stunting and wasting was more pronounced during 2016 to 2025 compared to the 2009 to 2016 period. When we look at these changes more closely through the lens of our 2016 framework's 3 groups, the first S1 region, which requires nutrition-specific interventions with direct nutritional support, as in the yellow box, shows particularly encouraging results. Compared to both global averages and overall yellow window figures, this region demonstrated greater reductions in stunting, wasting, and underweight. We believe this significant improvement can be attributed to the effectiveness of interventions aligned with SDG Goal 2 in the S1 countries. However, it's important to note that despite these promising results, the absolute prevalence rates remain above global target levels. This suggests an ongoing need for sustained direct nutritional interventions in these regions. WID has been working in one of S1 region countries, Cambodia, with a nutrition-specific intervention, and we will share it during panel discussion. Turning to the S2 region, where in addition to the nutrition-specific works, nutrition-sensitive interventions need to be considered, as highlighted in the yellow box. We see mixed results. While there have been modest improvements since 2016 in key areas such as food security, sanitation infrastructure, and poverty reduction in S2 region, these gains have not kept pace with either yellow window or global average except poverty rate. Furthermore, nutritional indicators particularly suggest that more intensive intervention efforts are needed in these regions. Lastly, examining the S3 region, which requires long-term systematic interventions to address both undernutrition and overnutrition, we observe a divergent trend. While there has been moderate progress in addressing undernutrition, indicators related to overnutrition, particularly adult overweight and obesity rate, show a concerning upward trend since 2016. This paradoxical situation underscores the need for more sophisticated and targeted strategies to simultaneously address both forms of malnutrition in these regions. To illustrate our approach to these complex challenges, we will share with work in Mongolia during the panel discussions. Now I would like to conclude with a brief explanation of WITH's holistic approach for yellow window. As we have seen today, while global efforts aligned with the SDGs have brought positive changes to health and nutrition conditions in yellow window countries, it's clear that more intensive efforts are needed to address the persistent challenge of hunger. Although WITH does not operate in all yellow window countries, we remain committed to contributing our expertise toward our shared global goals. Currently, we are developing and piloting programs based on life cycle nutrition needs designed to be adaptable across various contexts. Also, since we recognize that improving nutrition requires an integrated approach across multiple sectors, as shown in this slide, we will continue to leverage our health and nutrition expertise to develop and implement more comprehensive, integrated programs across multiple sectors. In conclusion, we look forward to expanding partnership and fostering collaboration as we work together toward our shared global goal of improving health and nutrition. This is the end of my presentation, and thank you all for your attention today.
Thank you, Ji-Sung-woo. I think we're going to have a Q&A session before the last speech, and I wish that all of you remember the word WITH, which means holistic interest through help. And the next speakers will be from S1 and S3 countries. First, I would like to introduce Bayan Jaragal, Director of the Mongolia Center for Improvement of Nutrition, MIN. Please.
Okay. Good evening, everyone. Thank you for giving me this opportunity today. I'm going to talk about change through Mongolian school meal program based on national institutionalization and professional training. Our country, Mongolia, is a vast nation located between two major powers, Russia and China. It has population only about 3.5 million living in big land. In terms of food and nutrition, traditionally Mongolian culture follows a seasonal diet, and people mostly consume meat and dairy products. Then from 1916, industrialization leads to shift the dietary patterns, making meat consumption a year-round practice. As a result, the traditional nomadic lifestyle began transitioning toward a more settled way of living. However, 30 years later, Mongolian transitioned from communist rule to democracy. Many industries shut down and leading to a severe economic crisis. And that time, same time, our country opened the borders and established international relations with other countries. In 1994, when my country was facing severe food shortage, a South Korean company, Suyang, now known as WIT NGO, sent representative to Mongolia enduring the harsh -40-degree cold. They established connection with the Mongolian University of Science and Technology, marking the beginning of our history of collaboration. In 2000, with the collaboration between WIT and MAST, established the Mongolian-Korean Joint Nutrition Research Center called as MIN, leading to the development of nutrition experts. Our center missions, conducting research and providing nutrition education and improvement public health, and developing policies and innovative the field of nutrition and advocating for integration into government policies. And also supporting training, professional development, and specializing of nutrition expertise. Now, currently our center operated 6 key areas, as we see, and education, training, and research consulting services, and etc. During the 25 years of our collaboration, centered around the MIN, we did a lot of works. And in the first 5 years, our university professors and students trained in South Korea, and also Korean instructors are taught in Mongolia. Since 2000, the first dietitians are trained in MAST. The first cohort dietitians graduated specialized in the internship program were introduced to train, certified them for both school and hospital. This training now continuously. From in 2005, a national study revealed a higher prevalence of hidden hunger among school children. In response, Mongolian government approved the regulation mandating provision of a school snack program. Our organization collaborated with the Ministry of Education and Science and launched Mongolian first school lunch project and developing 3 different school kitchen models by 2015. In 2011, we also established the first hospital-based nutrition consultation center and kitchen model. By the 2018, we recognized the need to focus on childhood nutrition from an early age. We partnered with the City Department Education to implement a kindergarten nutrition improvement project. Now, since 2020, we have working on developing nationwide integrated system to improve children's nutrition across the country with the Ministry of Education. Over the past 20 years, we have trained dietitians. As of today, more than 350 dietitians have graduated with 162 of them specializing in school and hospital dietitians. Some of our first graduates began working in universities and Ministry of Education and other government institutions. Today, hospital and schools are actively hiring qualified dietitians, including mining and heavy industry sectors. In 2000, there was only one university in Mongolia offered dietetic program. However, by today, 5 institutions will be training dietitians, further expand the field. Since 2006, we have implemented the model school meal system at city level, province level, and suburb level, and kindergarten models. Those projects show how to implement school lunch in different areas and what the school lunch service look like, and they comprehensively demonstrate the serving both classroom and dining hall with nutrition education by their student ages. These projects leads to understanding nutrition school food service system for all parties, and as a result, in 2019, the school food production law was approved, and it's since been implemented across the entire country. With the approval of the law, the need arose to establish a unified system for its implementation. In response, we are currently implementing the project Improve School Meal Service Environment and Build Capacity for School in Mongolia. This project consists of 3 key components. First is developing national guideline for school meal service operation, and second, creating a scalable model by implementing 10 schools, ensuring that other schools can easily adopt the system based on their infrastructure. Third one is also most important in human elements. It's establishing training centers that offer both online and in-person continuous education for school dietitians and chefs across the country. Our future projections to create a school meal production model can be implemented nationwide to establish the professional training system for school meal production and services. Since the approval of the law, the number of food suppliers for children's meal has increased, and creating numerous jobs and understanding education about nutrition among the population has been growing. Along with this, the monitoring of a school meal and nutrition has improved with better oversight from schools, parents, and national institutions. Through a school meal, population nutrition has become a fundamental condition for achieving several sustainable development goals, 1, 2, 3, 4, 6, and 10. Thank you very much for following my presentation.
Thank you, Bayan Janagal. It's very impressive that it's been already about 30 years in Mongolia, and we can witness the improvement of their nutritional status. We have another speaker from the yellow window, Cambodia, Suat Chandi. She is the project leader of nutrition development team with Cambodia. Suat Chandi, please.
Hello, I am with Cambodia. It is my great honor to have this opportunity to present what we have been doing in Cambodia. This project is targeting Tangsha commune, 17 villages, to improve nutrition for children under the age of 5, as well as pregnant and lactating women. So this is a comprehensive mother and child nutrition and health promotion project. And in order to carry out this project, we needed a holistic approach. First, we needed to increase nutritional intake through supplementary foods or food assistance services. Second, we needed household-based and healthcare center-based health, nutrition, and hygiene education and counseling services to improve eating habits and improve health and hygiene behaviors. Finally, we had to focus on providing safe water and improving the sanitation environment. And this is to induce health and hygiene behaviors and reduce infectious disease prevalence. So, focusing on community-based services, we utilized local staff as well as nutritional activists and healthcare professionals, and their capacity building was needed. This project started from 2015, starting with the pilot phase. And the first phase was from 2017 to 2019, the second phase from 2020 to 2021, and the third phase from 2022 to 2024. So we have had 4 phases spanning over a period of 10 years. I'd like to give you an overview of the project, and we were able to develop and supply nutritional supplements utilizing local ingredients, and we developed and applied intensive maternal health nutrition management program, and provide training and capacity building of health and nutritional personnel operating a nutritional education room within the transfer hospital, and water supply system improvement. And we have core professionals, including community health and nutritional professionals and local community activists. And they include, so they identified pregnant women and lactating women as well as their children so that they could carry out maternal child health, hygiene, and nutrition management at the local level independently. Now, for the health and nutrition program, the target was nutritionally vulnerable children under 5, as well as pregnant and lactating women. The health and nutrition promoters made regular visits to these households to provide education. So this was a target-specific topics and tailor-made education for people subject to the program. There are several characteristics of the approach that we've been taking, and the key is tailored and needs-specific education and providing tailored education. The health and nutrition promoters would identify the situations and assess the status of health and nutrition and prioritize individuals' health and nutrition needs and provided needs-specific education and provided tailored education. And then we monitored behavioral changes of the subjects. So there was this continuous cycle of personalized education based on their needs. And through this project, we were able to improve nutrition of children under 5 years of age. And for the first, second, and third phases, we were able to reduce underweight percentage, and anemia has decreased dramatically. Also, for main child care providers of children under the age of 5, as our project continued, we were able to see visible improvement. And this tendency was also observed among lactating and pregnant women. So I gave you an overview of the project that we carried out in Cambodia, as well as our activities for capacity building of nutrition and health professionals. And going forward, we're going to transfer this project to the community so that the community can continue to carry out this project independently on their own with the support from WITH, and this is going to be included in their local government functions. And as a project manager of this project, I'd like to share with you my experience. Last year, I was doing monitoring of nutrition and health promoters, and I was able to see and observe how they received training and provided services. Now we provide supplementary nutrition and other services, but later, if WITH has to choose between the two, which will be chosen? And when that was the question, the personnel said that if one has to be chosen over the other, I will choose education because nutritional supplement supply cannot be sustained, but education, after education is provided, we can continue to utilize knowledge, and this is going to have lasting impact not only on myself but also on my family and my grandchildren. And knowledge acquired through education can be applied in our day-to-day eating so that I can guide my children for nutritional food intake. So that was an answer from one of the promoters. And when I heard this, I was very moved. And these health and nutrition promoters are now playing a key role in their local communities, and I believe that they will continue to serve their local community and bring about bigger impact. And going forward, we can apply this approach in other countries that are in similar situations with Cambodia. And I hope that there will be more health and nutrition promoters in other countries and other communities as well. And with that, I'd like to wrap up my presentation. Thank you very much for your attention.
Thank you so much, Swajendi. I think she is a better presentation in Korean compared to me. Thank you so much. And I'm sure that in the near future, we're going to see how many changes are going to happen in Cambodia. One more time, thank you very much. We would like to move to the next speaker, Shin Jae-eun. She is the Director of Policy Center in Korean NGO Council for Overseas Development Corporation, KCOC. I think she will share some objective opinions about WITH. 신전-sim.
Good afternoon. It is a great pleasure to be here and to be here to talk about nutrition. As I was listening to previous speakers, I found myself feeling nervous because my previous speaker from Cambodia, she spoke so eloquently in Korean. I'm afraid my poor Korean might be compared to her great Korean speech. So she got me really nervous, but I will try to do my presentation. So in year 22, I had research outsourced from the Office for Government Policy Coordination, and the research topic was a study on the effectiveness of the NGO's ODA program. So as part of that research, I looked at the nutrition mediation project in Mongol, done in collaboration with WITH. So my presentation today is about Mongolia. So as we heard from the WITH representative, nutrition is related to many SDGs. So basically, SDG 2, ending poverty, with that, nutrition has a direct relations. And if you look at the nutrition intervention program in Mongolia, we can see that program has close connection to several SDGs goals. For example, SDG 1, ending poverty. So in 2006, the Mongolian government was receiving ODA, and we wanted them to use it as support to provide a school meal to children. So to that end, Mongolian government worked with WITH as well. Why is this important? Because thanks to this program, children, regardless of their parents' economic status, they were able to benefit from this program by getting a meal at school. And also, the program is related to SDG 3, health. For example, there are some chronic disease issues in Mongolia. So providing good nutrition via a meal can be a great way to deal with health issues. And SDG 4 as well. SDG 4 is about education. So this is a school meal program. So this is about education. And particularly, they had urban type school meal program and mid-tier urban type school meal and nomadic school meal type program. So 3 programs were developed to be adopted nationwide. And also nutrition is an important topic for women as well. So naturally, this issue is connected to SDG 5 gender because it invited many women to participate in this program. And as this issue was being legislated, particularly many women members of the Mongolian parliament took interest in this. Regarding SDG 6, which is about water, these foods need to be cooked and produced in clean, hygienic environment, HACCP certified facility. So in that end, this program is connected to SDG 6. And also this program is connected to SDG 8, which is about job creation, because this program produced 300 professional dietitians. So this program is very much related to several SDGs, and to that end, WITH played an important role. So these activities by WITH is also related to sustainability. So I want to highlight 5 main points here. So first, these activities by WITH specifically targeted a policy change on the part of the Mongolian government. Why? Because when we have a policy change in the government, the benefit can go to everybody of the country. So, but when NGOs typically work with the local community, so NGOs activities tend to be oriented at the local level in terms of providing services to the local residents. But if we can induce a policy change from the government, then this government can take over the relevant project because there was a policy change. So we can ensure the continuity of the program even after the NGOs leave this country. And also here I wrote the word comprehensive and complementary benefit. So years ago, the Korean government, so if you look at whether Korean government was involved in helping the nutrition situation in Mongolia, there was no activity from the Korean government. But if we have this kind of engagement, there is a benefit. You can start small. That is one benefit. That is the benefit of working in the food and nutrition area. And if you start big with a big package program, the risk also goes up. The risk of failure goes up. But if you go through the cooperation with a NGO, and if you start small for a project like this, then all the risk can be more effectively contained and managed, and you can get the result rather quickly, so you can prove the outcome of the program. So because of that, people can rather quickly see the tangible outcome of the program. So that in turn boosts up people's confidence in the program. So, and also third, multiple stakeholders can participate. So in Korea, there are many NGOs and companies, corporations, and government institutions, and the academia. And also from the recipient country, we can think about the central government, local government, and universities, middle school, high school, hospitals, and companies. So there could be various multiple stakeholders in the recipient country, in the partner country. Why is this important? If we did all these alone and it was successful, whose performance is it attributed to? It's going to be WITH's performance. But when you have an engagement from multiple stakeholders, this performance is attributed to everybody. So in that case, when you have a great performance, great outcome, it really feels great. And people realize that, oh, we need to collaborate together. So that alone ensures the continuity of this kind of program. And lastly, I want to share 2 points. So local-led development. So this is a development program led by the local partners. So as I was conducting interviews about this program, I got to talk to many Mongolian government officers, university people, and everybody said that these activities is by Mongolian people, but WITH helped us to do this well. So this was common feedback that I got. So the ownership of this program really belongs to the Mongolian people. What does this mean? It means that they learned well. And also Korean people, they live at one point. So the local people who are going to remain in their country, they need to take ownership and they need to operate this program after the Korean NGOs leave. So from the very beginning, the Mongolian multiple stakeholders participated, and from the planning stage, their ownership was embedded. And empowerment is important as well. Empowerment is also about human rights-based approach. In terms of the human rights approach, empowerment is slightly different from participation, because participation, you can participate as an individual and you can have individual success, but empowerment is more about inducing policy change ultimately. That is what empowerment is about. That is about raising your voice. So if you look at WITH's activities in Mongolia, they provided all the support. But in terms of persuading the lawmakers, the president, the government officers in Mongolia, it was actually done by local people through MIN. So local people went out there to persuade these stakeholders of their country. So that was a great aspect of empowerment. So if I can summarize this again, so 5 points I want to highlight. To have a sustainable development, we need to induce a policy change of the local government, and we need to have collaboration of the local community, engagement from multiple stakeholders, and the development program need to be led by the local people on the field. And empowerment is really important. Because all these 5 elements were well included, this program was successful, and I'm confident that this program will continue on in the future as well. Thank you very much.
Thank you. Now it's time for Q&A. So in the floor, is there any question? You can raise your hands and ask questions. I think we have some time, so over there.
Thank you, Professor. My name is Duya Emmanuel. I come from Ghana. I'm a student at the Graduate School of Public Health, Global Health Security, Yonsei. Yes, thank you for the opportunity, and thank you, the presenters. Yes, I appreciate the presentation very well, and I'm more interested in the nutritional aspect as a public health expert in my country. Currently, Ghana, we have a burden of nutrition issues we are battling with. And during November, December, we have a very big drought in the northern part of the country. And support from Korean government donate food to these people. And during the presentation, I'm more interested in how climate change and nutritional issues can be addressed going forward as a country, especially in African setting like Ghana? Thank you.
Thank you for the question. As you mentioned, there is a very close connection between climate change and nutrition. And nutrition can also be related to climate change mitigation and adaptation. So nutrition has implications for both climate change response, climate change adaptation, and climate change mitigation. So in our organization, we understand the nexus between climate change and nutrition. So we're trying to incorporate climate-related aspects to our programs. For instance, lactating and breastfeeding. And breastfeeding can serve as climate mitigation strategy and reducing food waste and also shifting away from meat-based meals to reduce meat consumption. All of these are mitigation strategies, climate change mitigation strategies. So these are the areas where nutrition can contribute to mitigation. And another pillar is climate change adaptation. And when it comes to adaptation, nutrition can serve a role because we need to make sure that individuals are well nourished and well fed so that they can continue on with their lives despite climate change related events. So nutrition can play a part in terms of climate change adaptation. So we're focusing on yellow window countries, so nutrition specific and nutrition sensitive and comprehensive and long-term approaches. So we have different groups of yellow window countries, and depending on their situations, we apply different strategies. And in the long run, our activities can contribute to climate change adaptation and mitigation. But the bottom line is climate change is affecting food production. And so we need to think about alternative nutritional options that we can utilize in the face of climate change. And so actually in many African countries, they are in possession of many alternative food options. And we need to make sure that such alternative options are well received, especially insects and other animals can serve as source of protein because cattle and hogs, they produce a lot of carbons. So we can supply protein from different sources, and such alternative sources will become more and more important. And we need to help people understand that these types of protein sources are also nutritionally sufficient. So this is something that WITH can do. So in our organization, we're focusing on climate change adaptation and climate change mitigation, and also responding to food supply disruptions. And well, our presentations were not able to show you everything, but we will continue to incorporate climate change. I hope that has answered your question. Thank you.
I think there was no presentation about the WITH activity in Africa, but they are working in some countries, African countries such as Madagascar and Tanzania. So maybe in the future we might have a chance to share how they are doing in Africa also, the WITH activities. So let's see what we can do with other activities. Any other questions in the floor?
I'm Tan Kang, a junior student at Yonsei University. First of all, thank you so much for your wonderful speeches. It inspired a lot. And also, I recognize again how imperative to solve the nutrition problem is. While listening to the speeches, I noticed that the WITH is deeply concerned about a wide range of the countries, not only just one. So, but around the world, as we know, there are so many countries and cultures. So I was wondering that how cultural differences impact the implementation of nutrition programs, and also how does the WITH address them?
please.
So as you are aware, nutrition is about food. And as you mentioned, so each country has their own food culture. So nutrition is very closely related to cultural aspect of a country as well. So when we want to pursue nutritional improvement, ultimately we need to touch upon dietary practices. So, for example, your eating habits, what kind of food you're eating, those need to be changed and improved. So, in that process, each region or each society, they have their own culture. So, their culture has just a huge impact on this kind of program. And as you might be aware, when we do ODA programs regarding medicine, for example, drug, pharmaceutical products, the outcome can be produced rather quickly. But nutrition, it takes time to produce a visible result. So it's a naturally long-term effect. So we need to think about what we want to focus on. And we also need to bring out changes in the way people consume food, what kind of food they consume. So our activities are focused on long-term perspective. So we just have a long-term perspective, basically. And what kind of elements of a given country's food culture do we want to focus on to have an effective program? So we think about it really hard because we want the local people to feel the need to change their dietary habits so that their nutritional status can improve. So we also need to change people's perception about food and food culture, and that is an important aspect. So we also need to think about their culture, and also because we are an outsider, we cannot just kind of lecture to them. That is not effective. In Korea as well, or if you've been working in international cooperation project for a long time, you will know that just lecturing as an outsider is not going to be effective. So we need to understand their way of living, and we need to find points that need to be improved, and we need to use appropriate tools. So I cannot talk too long about this, but for example, positive deviance health. This was a program that we conducted. So let's say your living conditions are quite poor, but still, despite your living conditions are poor, the children's health is quite good. So some families, their children still healthy and they grow up well, even though they are not rich, even though they're poor. So what factor is making a difference? So we find that. So that is what positive deviance program is about. So we want to identify those areas, and particularly we want to improve the nutrition of young child aged at and below 5. That is a really effective way. So how can we address their nutritional issues? How can we improve their health conditions? And so these are some easy points that we want to identify that people can easily practice. So we want something that is easy to practice for the local people so that this can be sustained. So that is what with activities or our approach is about. Thank you.
Thank you.
Let me now switch to Korean. Well, we have with us all these wonderful speakers, so I would like to ask a question myself. There are many different ODA projects, and we have with us Dr. Shin. So starting from design, you need to focus on cultivating local leadership, and main projects can be carried out successfully, and COICA and EDCF. And I wonder if ODA institutions are concerned about that are taking that approach. Currently, in the international community, localization and locally led development are the key words these days, which means that development has to be led by the local people. When we look at the history of official development assistance, since the Second World War, ODA has evolved and ODA budgets have increased. But when it comes to effectiveness and the performance of these ODA projects, a lot of people became skeptical and pessimistic. It is because there was lack of local ownership, and people were able to identify that lack of local ownership was a root cause behind some of the ineffective projects. In the past, people thought that local ownership was about ownership by the local government, but that was not enough. So in the 2010s and 2020s, we consider localization as a way to make sure that local communities and local residents lead development. So in that sense, with WIITH, this organization is indeed pursuing the strategy, and they started this from 1990s. So this is great.
Now we already ran out of time, but please forgive us to move to the final speaker, Yonsei, Director with Institute of Nutrition Improvement. Please.
Hello, everyone. Today, I am going to discuss holistic changes for yellow window countries, and I would like to say that you will join us for this journey, not just today, but in the future as well. You have already heard that there are yellow window regions, and it may be your first time learning about yellow window countries. And WITH is an organization with nutrition professionals so that nutrition can be improved in yellow window countries. And we want locally led initiatives and locally led change, and that is our priority. Until now, we have been collaborating with many global actors to promote sustainability, and we've been fostering and educating health and nutrition promoters in the local community, and nutrition-specific and nutritional-sensitive programs have been carried out, and we were able to confirm the success and the outcomes. Better nutrition for all is our key mission. We're targeting yellow window countries where they experience nutritional challenges, and this is in line with the SDGs philosophy of leaving no one behind. And also, this is in line with the theme of GEEF 2025, Time for Action, Bridging Divides for a Sustainable Future. So there is a very close alignment with WITH's initiative, with the SDGs and GEEF 2025. We have 3 calls for action. First, we urge that there would be more collaboration for integrated approach based on community research. I've been with WITH for 20 years, and I've been in charge of research and engagement. And currently, in yellow window countries, we continue to identify their specific needs, and we conduct regional research and local research, and we're doing this actively to identify specific needs. We're working with international organizations, governments, NGOs, and other stakeholders. We continue to share resources, and we provide evidence so that systematic improvements can be made. So we need more collaboration for community research. Second, we need to empower local health and nutrition professionals, because nutrition is an issue that cannot be addressed overnight. As was seen in previous examples, in order to overcome nutrition challenges, we need creative and innovative changes. And such changes can only take place when we have local leaders who are empowered. We can utilize universities and technical training institutions like educational institutions to empower and educate local health and nutrition professionals and technical personnel. And we can implement a mentoring network that connects future leaders with experts. And finally, we need more support for nutritional programs for vulnerable people. We need to continue to provide support for the most vulnerable populations. We may have nutrition-specific programs and nutrition-sensitive programs to cater to their needs. Also, we need to think about providing nutrition support and health support for people like people in North Korea. We are pursuing holistic approach. We include health, education, advocacy, policy advocacy, and nutrition. And by taking this holistic approach, we can maximize outcomes. And I hope that you will all join us on our journey, and we would like to welcome all of you. Thank you very much for your attention.
Thank you so much, everybody. I think all of us now understand what yellow window means, and also what WITH means, holistic interest through health. And I do wish that all of us collaborate together and empower local professionals and support this organization such as WITH. Thank you for your patience, and we will close this session.
Thank you very much. Thank you for the session. It was great to see a set of long-term efforts from countries in the yellow window with a deep analysis on trying to understand why the WITH program was such successful in these countries. I think the case study was wonderful, presented in the session.